The whole goal of this video, or this capture, this video, is just to educate people.
Okay.
That is a solution out there, and not living with foot pain. I would like to have you share your story about your journey with your foot. So obviously you come to see me because the condition is worsening, and you would like to know if there's other option to take care of this. So can you share with us what you have and what you had and what you have now?
Sure. Well, years ago, I had very bad trouble with my one toe, and I had the joint kind of removed. The toe was cut, the bone was cut. So over the years, it got better, and then it got worse. I started having a lot of trouble with bunions. In fact, I have them on both feet. I think I inherited it from my mother. But the kind of work that I do, the lifestyle that I have, I love to walk. Very active. I walk and walk and walk. And the last couple of years, it got to the point where I went from 4 miles to 3 miles to 2 miles. And every time I'd go for a walk, the foot would swell, it would hurt, and it would impede both my personal time and my teaching time. Because teaching, I'm on my feet a lot. I do Tai Chi walking, and it was affecting my ability to really teach. I felt my own posture starting to get off because my feet were no longer flat. And I work a lot with people on balance, and it was affecting my own ability to
balance yourself.
And I knew I needed to do something. I avoided surgery for 5 years. I was scared to death of it because I knew what I went through with my first one.
Just to explain more about what you had before the procedure that you had 16 or 17 years ago, we call that is a Keller procedure. What that would do is actually kind of like helping reduce the arthritic on the joint itself to allow the toe to bend normally. But what happened is that with that Keller procedure, part of the bone got removed. So when it got removed, all the soft tissue got tightened up, and it's actually create a little bit in the long-term effect. They create a lot of scar tissue on the area, and now the joint becomes even more stiffer, and the toe not be able to bend itself. And that's when the pain is progressively. But the option to take care of it, if we move forward with it traditionally that we normally do, would fuse the joint, because the joint no longer moves. And so most of the time the doctor will suggest to fuse the joint. And the fusion of the joint is actually will take away the pain on that joint itself, but it's going to affect the different joint on the remaining part of the foot. When you saw me the first time, we were looking at your left foot, because at that time your left foot is more severe, but then after a while your right foot will become more severe, progressively worse. So we decided to work on the right foot. And the right foot, that way, the option of fusion, I don't think that is you ready for fusion, because we definitely want to make, we want to salvage the joint, we want to help them. So the technique that we were doing, we reduce all the arthritic joint, we can repair all the arthritis conditions on the joint itself. We open up the joint space, so allow you to bend the toe without any problem.
Before, it didn't move at all. Now it bends.
Now it bends, right? And it bends right away. It bends right after that we worked on, and we have the picture to prove it.
Yeah, during the surgery, I saw you doing this with my toe, and I remember hearing you say, "Well, look at this."
So, what do you say about the process of having the procedure done at the office? What's your impression?
Believe it or not, I was telling my friends, believe it or not, it was actually fun. Which is kind of strange to say about surgery being fun. It didn't hurt. It was very well numbed. Seeing the procedure on screen was wonderful, because it was just like I could see what you were doing. And my wife said it sounded like you were just sitting around having your nails done, which is kind of what it was like. It was just like we were conversing, very friendly, as relaxed a procedure as you could possibly imagine. It was great.
Right. And you'll be able to walk right immediately right after the procedure.
I walked out of the office. I took, again, seeing as I teach, I need to be on my feet. I remember saying before the surgery, I said, I need to be able to walk, and you were like, you'll be fine.
Mm-hmm.
I was back teaching my classes the following week. Monday, this procedure was on Friday.
Mm-hmm.
Monday and Tuesday I took off. Wednesday I was teaching from chairs. The following Monday I was back to teaching.
Mm-hmm. Very good.
So it was just like within a week and a half I was back. You know, it ached,
Mm-hmm.
but I was able to walk and do all my things. So, it was,
so aching is a typical sensation right after procedure. We call this a surgical pain.
yeah, the joint's fine.
Uh-huh.
It's just all the parts that haven't moved in years. They're like, oh, what do you want from me?
You want me to work harder? Yeah. Yeah, so what would you say to anyone who had a similar condition? What would you say? Don't wait for 5 years, don't wait for 10 years?
The one thing that I do have to say is getting back to what it was like to have the procedure done in office. Beforehand you said, this is what time we're going to start, this is how long it's going to take. Everything worked like clockwork.
Mm-hmm.
You were spot on with everything that you said.
Mm-hmm.
Another thing, a lot of doctors don't communicate.
Mm-hmm.
Your communication skills. You were like, this is what we're doing, this is why we're doing it, this is what you could expect. It was great.
Well, thank you for that. Yes, you know, sometimes that I do things like so my routine,
Mm-hmm.
but you know, to when the patient kind of like see that is very impressed for them. So you know that I'm very appreciative of your
Even my wife was like, she's very personable,
input.
which is, you know, because we both have experiences of having doctors that are just like, they have no, no bedside manner, completely opposite here. So it's great.
Well, I'm very happy to hear that. Yeah, absolutely, very happy to hear that. So your recovery is so, I would say, outstanding. You know, like every time I see you, your joint moves much better.
So you told me what I have to do,
Right.
and be prepared. They are going to have to do some work.
Mm-hmm.
It's not just like they're going to walk out and not have to do anything about it.
Right.
So as long as they are careful, follow your instructions,
Mm-hmm.
and are willing to say, okay, I know I'm going to have to do something here.
Right.
They'll be fine.
Yeah. Very good. Well, thank you so much, Stanley, for sharing
You're very
your
welcome.
story. Yep.
No reason not to refer, recommend, or come back myself. So everything was just good.
Yeah.
Perfect.
That's what I love to hear.
To find out more about minimally invasive foot treatment, contact Feet and Beyond at 908-576-0880 or visit feetandbeyond.com.